Love for groups is what actually brought me into the field to begin with. Like, that was what I wanted first, was to be a group therapist, you know, with addictions and trauma. But what happens is that people who suffer from addictions and people who suffer from trauma, and in many cases we're talking about the same population, they often mistrust authority figures for very good reasons, both people with addiction and people with trauma. And again, there's a lot of overlap. And so if you have a therapist and you have the patient, like, all they have is an authority. But with a group, what you have is you have the authority figure, but you also have all of these group siblings. You know, like you have, okay, a new family, and here's the parent and here's the siblings. And when you have trust issues, and let's say you're really afraid to share your anger with the therapist, you could use your sibling support in the group and like build on it, subgroup, and bring that in. And also, here are all these other people that could support you in different ways. You might say something that you're not quite sure, this is what I feel. You might say, oh, this or that, and then someone might say, I get it, like, this is the experience that I have. And then, you know, someone else might say, well, wow, I have different words for that. And someone might say, well, that really resonates with me in this way. And so people are building a new understanding together, and over time the group can become a replacement family. There's a lot of movement in that process, you know, and a lot of honesty. Like, we could go deep, and also as people are developing deeper trust and attachments, and new people are coming in to the group, there's a culture of recovery already there to pull some people in so that they have models of recovery, and again, not just the therapist. You know, and also a therapist, when there's other members, a therapist could take some risks a little bit more, because, like, you know, if I go up there and challenge you at the edge of your window of tolerance, and if I take a risk and do that, and a lot of stuff kicks up, like abandonment issues or the potential for re-traumatization, there's going to be all these other people here who could provide some support as well. There's a lot of reverberations. A lot of things happen when people commit to recovery. They also become willing to share their stories. They become willing to model recovery, to teach, to help others, like, to be examples. And then, especially in family systems, even when people stay sick, because oftentimes a lot of people are still sick, still addicted, but then when new people come in, or people from the family system, and they're willing to get well and recover one day at a time, they now infuse their family system with recovery too. And so you have something very beautiful going on.